Hi everybody and welcome. Today you are going to see a full neck treatment with Vsoft Lift PDO smooth threads. So you can see here I've used this ladder formation where I'm going to place threads on the anterior neck and then lateral neck as well. And I've spaced these PDO threads accordingly. We are going to stimulate collagen about 1.5 millimeters from where your thread is placed, and therefore I sort of want one right after the other. So my thread selection for today is a 29 gauge by 40 millimeter twisted thread. Your twisted threads are going to really maximize the collagen stimulation that the patient will experience for a couple of different reasons. There's more tissue injury upon placement of the thread, and therefore you get the more stimulation. It is also a longer thread as well, which will again increase the amount of collagen that we make. So I tend to reserve these for our more advanced cases. In particular, this case you can see the patient is older in age and does have pretty significant laxity and static creases in the neck. This is a procedure we've done on this patient several times in the past, so this is just sort of her annual maintenance treatment, if you will. She actually has had surprising results. The initial time she wanted me to treat her, I was not expecting super great results because of the extent of the laxity in her neck, but surprisingly, she had really, really nice results. The texture of her skin improved dramatically. She had tightening in this area as well. And so we found that this is a great procedure for this particular patient who is wanting to avoid any surgical procedures or anything more invasive than this. And so Vsoft threads are a great option when you're looking for just that, when you're looking for collagen stimulation to help with texture and tone, fine lines and wrinkles, skin laxity. All of those concerns can be addressed with PDO smooth threads. And so for this patient in particular, this is her preference. So we did numb the area topically for about 10 minutes prior to starting. And then again, the area has been cleaned and prepped and we're placing our threads. The twisted threads in general can be a little bit more challenging to place. And so you can see here, you meet a little bit of resistance as you're placing it into the tissue. But overall, once you're properly trained and you know the appropriate depth and plane that you should be in, it should be relatively easy to place these threads. I'm going to come to the other side and do the same thing. So again, you can see here, it slides in fairly easily. And I do always recommend a training course for this, just so that you really get the hang of being in that proper plane and knowing that your depth is appropriate. Placing these too superficially, unfortunately, can lead to thread visibility and a lot of discomfort for the patient. And if we're placing them too deep, then of course it increases the risk of hematomas, any sort of nerve irritation. We don't really want to place the threads all that deep. You can see here on one of the top threads, she did experience a bruise. That's a little hematoma there. And, we educate our patients prior to do any procedures that bruising and swelling should really be expected. Of course, if we can get away without a bruise, that's even better. But this is why we always tell patients, please don't plan procedures. If you've got something special coming up in the next couple of weeks, we want to allow for appropriate healing time. This patient, we did start on oral arnica, which is a homeopathic medication. It will help her downtime and help minimize that bruising that she has. So nonetheless, she did very well. Aside from the one bruise there on the right neck, she didn't experience any other bruising. And that can easily be managed with, some pressure and an ice pack to try and help that swelling as well. You can see I'm just sort of applying pressure there to try and get it to break up a little bit. But overall, she did very well. This is her first procedure of 3, and then we'll give her a break from 3 to 6 months where her body will peak in that collagen production to really evaluate her results from there. Thanks for watching.